and before I would enter the patient's room, I would go ahead and set up my IV fluids. Okay, so I see here I do have 0.9% sodium chloride, and I would match this with the MAR and check it with the 5 rights of medication just to make sure that I would be giving it the right route, the right dose to the right person at the right time. Okay, so I'm going to go ahead and open this here. And I do have my IV tubing. This is the correct tubing. It's for primary line, and that is what this will be today. Okay, and as I'm taking this out, I'm going to go ahead and make sure that my roller clamp is clamped down for while I'm preparing. Okay. Go ahead and kind of straighten this out here. Okay, so I do need to make sure that this remains sterile. Medication port here. Okay. So I'm going to go ahead, hang this up. And I did already lock this. So now I'm just going to squeeze this out a little. Okay. I'm going to unlock this now and prime my tubing.
We're good. Okay. Let's clean up.
Okay. And I no longer see air bubbles, so I'll go ahead and lock this again. Okay. Go ahead and hang this up. Okay, and I do need to put on an alligator clip. So I'll go ahead and open this. Okay, just have to make sure that I do not touch the tip here because that is still considered sterile. Okay, so my IV is ready to go to the patient's room. Okay, now I would enter. Hello, my name is Janie, and I'm going to be your student nurse today. Before we get started, I'm going to go ahead and close the curtain to ensure our privacy. Okay, and can I have you confirm your name and date of birth for me? All right, great, thank you. And do you have any allergies I should know about, such as like Benadine or Chloroprep? No? Okay, great. And do you have an arm preference, like to get your IV on? No? Okay. And I will be doing your IV today. This is just some sodium chloride for you. Okay, so I guess I'll get started shortly. All right, I'm going to go ahead and prep my extension set here. Okay, so I have loosened my cap. Okay. And this top here is considered to be sterile, so I cannot touch that. Okay, I'm just going to push that in there. Okay, and I do need to remove the top here. I cannot touch that. I'm going to just put it back in here to make sure that it remains sterile. I'm going to prep my IV start kit. Okay. I do have my tourniquet here. I'm going to go ahead and prepare some tape. This is just for once I get the IV inserted, I will need to tape it into place. I will need my tegaderm, my gauze, but I will not need sterile gloves because this is a clean procedure. Okay, great. And you did say you didn't have any allergies. Alright, and you don't have an arm preference. Okay, well I'm going to go ahead and use this arm. It seems like it has some pretty good veins on it. Go ahead and apply your tourniquet. This will be a little tight, so you shouldn't feel any pain, but let me know if you do. Alright. Go ahead and find a good vein. Alright, and I do think I'm going to use this vein. So I'm going to go ahead and put on my gloves. And again, these are clean gloves, not sterile gloves. Okay. Alright, so I'm going to go ahead and clean this for you. Okay, and I need to allow that to dry for just a second. And I will be using a blue 22 gauge cannula today, because that is what is appropriate for the size vein that I have chosen. Alright, you might feel just a pinch, Mr. Jones. Okay. So I'm going to go in with my bevel up at a 10 to 30 degree angle. Okay, and I do see flashback, so I'm just going to level and go 1/8 of an inch further. Okay. And now I'm going to go ahead and pull this down. Before I remove that needle, I'm going to go ahead and pop my tourniquet. Okay. And I'm still occluding that just so no blood or anything splatters out. Okay. Alright, so my extension set has been applied. I no longer have to hold that pressure. I'm going to go ahead and flush. And this also, even though it is a blunt tip, it will be going into the sharps container. Okay, so now this is where my tape comes into play here. To apply my tegaderm. And this is very adhesive, so I need to make sure not to touch anything with this besides where I want it to go. You doing okay, Mr. Jones? Alright, great. Okay, and I will need to date, time, and initial my tegaderm, and put the size gauge that I have used. Okay, so that would go right there. All right, so now I would need to go ahead and discontinue. Well, before I discontinue, I have to apply my fluids here. Okay. So go ahead, make sure that this is clamped. Clean this tip with an alcohol swab here. Okay. I would tape this down. Okay, and then I would open my clamp and have the fluids run through. Okay, so now several days later I would come back and need to discontinue my fluids. So I would need to, at this point, clamp my fluids back. Okay. I need to go ahead and start undoing this tape here. Okay, remove this. Okay. And now sometimes you would leave the extension set present, but for this we are completely discontinuing. This patient will no longer need an IV, so we can take it off completely. So I'm going to go ahead and loosen all of my tape. Okay, and then I would need to apply pressure as I remove it. And my cannula, my IV cannula is intact, and so I would need to document that. And I would apply a gauze here, and I would put on a Band-Aid, and then I would take off my gloves and dispose of everything per agency policy.